As the country continues to see a decline in COVID cases, life has somewhat returned to normalcy, with many stringent COVID restrictions in the past now being relaxed. Despite this, the Minister of Health, Dr. Frank Anthony, has said that the government is considering the recommendation, which was given by the Centers of Disease Control and the Food and Drug Administration of the United States, to offer booster doses to persons 12 years and older. Although thousands of Guyanese have taken the COVID vaccine, the same cannot be said for many adolescents who have yet to receive their COVID shots. Their shot is given with the consent of their parents. Today, Headline News spoke to a few parents who expressed varying views about the vaccine.
Owing to the booster shot, I I do think that parents should decide for the children if they should or not take it, because many people have died in the past. But for the students, parents must make that right decision. I do think that whatever decision they make, it should be beneficial for not only them but also their children.
I'm a parent of two teenagers. I think the booster shots, I think the parents should, yeah, they should give the children the booster shot, should be allow the children to take the booster shot because it helps them. Because myself as a parent, I took both of my booster shots. I took both of them, and it helped me because I could remember one time I wasn't feeling so well, and that Saturday I decided, well, I have to go and take that booster shot, and that was my first booster shot. So I went and I took it, and to my surprise, when I go home, I had complication with the fever, yes, but I was feeling much more better. So for the children, I think that yes, they can take the booster shot because it will help them a lot.
On May 10, 2021, the Food and Drug Administration expanded its emergency use authorization for the Pfizer BioNTech COVID-19 vaccine to include adolescents aged 12 to 15 years. This authorization was followed by interim recommendations from the Advisory Committee on Immunization Practices for the vaccine among this age group. Meanwhile, while with school around the corner to fully reopen their doors on April 26, the Ministry of Health continues to urge parents with children above age 12 years to get them immunized. Additionally, with the World Health Organization approving the reformulation of the US-made Pfizer vaccine for children 5 to 11 years, Minister of Health Dr. Frank Anthony said the ministry would train healthcare workers to administer the vaccine to this population. For Channel 2 Headline News, Esther Sobers.